So first thing we're gonna do, we're gonna look at where we have the golden lock zone. Two scattered here, two crowded here, that's a good place for a start. I'm gonna put it in a bigger augmentation here. Okay, you cannot tell anything about the red blood cells because you don't have a reference number. Some look like have a little bit of a halo, maybe a little bit of anemia in here. You can tell it now. Let's see. You know what? I can see that there is a discrepancy in size. Some are really tiny. Some are bigger. Some are even bigger than the lymphocyte. I can see, I would say this person does have an isocytosis. I do not like gauging the level of hypochromia by looking at cells that are bigger than the nucleus of a mature lymphocyte, because it might be not because they have too little hemoglobin that they look pale. It might be because the hemoglobin is more dispersed through a much bigger cell, so it looks much less of a quantity of hemoglobin when in fact it's not. So let's start our I can see anisocytosis. I see that some cells that are indeed the size of the nucleus of the lymphocyte here, though, do have a little bit bigger halo. So if this pattern repeats, we might consider, I think I see a level of microcytosis, maybe a trace to 1. And I see some hypochromia. Maybe let's see if that repeats. So this is a lymphocyte. Neutrophil, neutrophil. Monocyte. Neutrophil, neutrophil. Neutrophil, neutrophil. That's a little bit too scattered. Let's go find a more of a golden lock zone. First, should finish our diff. And because the smear tends to have a tail, you often have to go in and out of that zone where, see, there's two staggered here, where the level of cells are good. So neutrophil, pass somebody a neutrophil. Neutrophil, 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 neutrophil. I think I have a bubble in here. Let me try to get around that bubble. monocyte, lymphocyte, neutrophil, monocyte, neutrophil, it's a eosinophil. Trying to see if I can get your eyes to be able to see. The granulation is much bigger. The color is different too. The coloration is bigger. Neutrophil. Eosinophil. It has 3 lobes instead of the normal aviation glasses that we say it's characteristic of a eosinophil. But you can see the lobes are bigger and very oval, elliptical in shape, is still much like the aviator glasses would be. And I'm trying to get a better focus. I'm going in and out of focus so you can have a more of a 3D view of the cell. So that's eosinophil. Neutrophil, neutrophil. Getting a little bit scattered. And go in. Monocyte, neutrophil, 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 neutrophil. And today in class I'm going to talk about that feather shape of the smear and how you have to keep on going in and out of the crowded zone. This is 2 neutrophils. It's getting a little bit crowded. It's like neutrophil. I think there is. This neutrophil here, I'm going to bring it closer to the center here. This is a neutrophil that doesn't have segmentation. We call this neutrophil a band. We're going to count that as a band. It is important to notice bands when you're doing your manual differential because it can point to a acute condition of a bacterial infection. And when you have something like sepsis, you have a lot of those. This is a eosinophil, very good aviator glasses. This one you can almost see how orange it is. The coloration is much better than some of the ones I'm showing you. Lymphocyte. Mature lymphocyte. When you see a mature lymphocyte, look at the cells around it. Yes, there is a level of microcytosis. Some of the cells are really small. And I see that cells that do have the same size as the nucleus of the lymphocyte still have a halo that is a little bit bigger. I'm going to tell that this patient has hypochromia, and I see some cells are a little bit bluish, and I think I would characterize that as trace amounts of polychromasia. Always trying to get a field where the cells are the best characteristics because they don't have this, the RBCs are not too crowded. Neutrophil, 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 monocyte, neutrophil, 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 lymphocyte, neutrophil, 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 neutrophil is getting a little crowded, neutrophil. That cell is smashed. I'm not gonna even pay attention to it. Neutrophil, 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 neutrophil. Yes, definitely some polychromasia, and normally you see the cell that tends to be a little bluer. It's also a little bit larger, and that's consistent with that cell probably being a little bit younger. Neutrophil, where that? Neutrophil, neutrophil, monocyte, neutrophil, 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 it's two. I'm going to the microscope to see this one. It's a neutrophil, but it's smashed. I'm not gonna count it. Neutrophil, neutrophil, neutrophil. It's getting too scattered. Let's go to battlefield, neutrophil, neutrophil. It's a little bit better field. Let me find that here in the slide, a better field. Neutrophil, eosinophil, neutrophil, we've already seen this one, so let me go to a completely different area of the slide so we don't risk count some of the same. Neutrophil, neutrophil. Look at this neutrophil has, like, let's count the segments. 1, 2, 3, 4, 5. 5 is actually at the limit, or I would consider this a normal neutrophil. If I start seeing 5 to 6 to 7 segments on a neutrophil, I start looking at the possibility of being a hypersegmented neutrophil. And I see some of the cells are a little bit bigger. I almost see maybe a 1+ macrocytosis, maybe trace of microcytosis. This may represent a patient that can have a iron deficiency and a B12 folate deficiency. You can have more than one deficiency, nutritional deficiency. So it's not that rare to find that. Neutrophil, and if you start seeing a lot of hypersegmented neutrophil, that's a really important finding. Eosinophil, neutrophil, and think about this. This patient is already having a little bit more eosinophils than normal. Eosinophils are often associated with parasitic infections. I'm not saying that's the case because most of the neutrophils in here are not hypersegmented. I'm just drawing an idea for you to have in mind that when you're doing a slide, you actually have to understanding the pathology and physiology and put that all together, because if you start seeing a lot of eosinophils and then you see a lot of hypersegmented neutrophils, which you didn't here, that was just one out of many. But if you start seeing that pattern, that is something that you should really be detailed on your presentation to the physician, because it might be diagnostic. Let's just finish up that diff then. Neutrophil. I'm trying to find when it's golden lock zone. I don't like counting when it's too crowded. Monocyte. I need to find it. There is a bubble in this slide and I'm trying to go around that bubble. Neutrophil, neutrophil, neutrophil. That's another band. I am going to count as a band. But up to 1 or 2 bands is not anything that you should be concerned about. It's more when you start having a lot of bands that you need to start being worried about. Then it's an indication of infection. Neutrophil, neutrophil. Neutrophil, neutrophil. I'm gonna go around that bubble. Neutrophil, 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 neutrophil. Eosinophil, and that's 100 cells.